So the first question is, can polyps be diagnosed via ultrasound? Can polyps be diagnosed via ultrasound?
Yeah, polyps, as I was telling you in my talk, they can be diagnosed by doing a sonohysterography. That is, we put saline inside the uterus and do a transvaginal ultrasound so we can see the polyps. And then we confirm it with hysteroscopy and we can remove the polyps then. Because the polyps can interfere with implantation, so it's better to remove them before doing any further treatment.
The second question, Dr. Anjiru Ndego, just come forth. If you have PCOS, which later on brings on diabetes type 2, are there any chances to get healed, or are you doomed to take meds forever?
I just want to say that PCOS is one of the best diagnoses for anybody who is suffering from subfertility. A lot of patients with PCOS, about 98% will get children if it's managed well. So it's nothing, I feel that that's not one of the worst diagnoses. But to answer your question about type 2 diabetes, the incidence of diabetes with PCOS, Google is not your friend on that because a lot of patients will not get diabetes. Very, very few. Actually, I've seen probably one or two in my whole career, which spans more than 15 years. So it's not a big thing. I think you have to, if you are the unlucky ones who get diabetes, check that it's also not in your family line because it could not be related to the PCS anyway. But if you have diabetes, then yes, you have to manage it, and that's so you need to see a diabetologist who will manage it with proper medication. Sometimes all you need to do is diet, so it's not about medication for a lot of people. You can change lifestyle and diet and control your diabetes. So I don't, but it's very rare to find PCOS with diabetes, to be honest.
Maybe while you're at it, just Dr. Anjiru, the next one. Is it true that pregnancy cures endometriosis?
Okay. I'll say this. I have worked with a lot of endometriosis patients, and endo is one of those things that I wouldn't wish on anybody. It is intense pain every single month, having to go to doctors and having all that psychological strain plus emotional plus physical pain. It is a chronic condition, and what chronic means is that it will continue with you. It is something that a lot of research is being done about how to cure it. There is no cure from endometriosis. Pregnancy is not a cure to period pains. And I remember when we were in high school, those people who had bad period pains would be told just get pregnant, Itaisha. If you have endo, pregnancy does not cure it. What pregnancy will probably do is stop it for a while because we're pregnant and we're not menstruating, therefore we won't have pain, and the progesterone hormones will reduce the levels of it at that point. But once 2-3 years later, it will come back. So pregnancy is not a cure.
Okay, my name is Faith Moki. I have a question concerning IVF. When you start doing the IVF journey, how long does it take for you from the first consultation, IVF consultation, till you graduate from, is it fertility doctor to your gynae? And then what are the tests that are supposed to be done for you to do to get to the IVF? What is expected, the hormonal and the injection and all stuff. What is expected of a person who is supposed to do IVF, and how long does that journey take? Like 8 months, 6 months, 2 weeks, I don't know.
Okay, so regarding the IVF journey, it all depends upon what is the problem with you or the couple. Now, if it is, it has to be diagnosed by certain tests. And I think I enumerated all the tests for the female as well as for the male in my talk. So all those tests have to be done. Once we get to the diagnosis, we can immediately program you for the IVF. And the actual IVF procedure that you talk about, that is the injections, hormonal injections, they take about 10 to 12 days from the second day of your menses. So your menses have to be programmed by oral contraceptive pills. Once you get your menses from the second day, we start the hormonal injections for 10 to 12 days. That is the time it takes for the eggs to grow or mature. Once the eggs are matured, we trigger them and then we retrieve the eggs under anesthesia through the ultrasound, under ultrasound guidance. That takes another 2 days, and then 3 more days for the embryo transfer. So totally 18 days for the actual IVF procedure. 2 more weeks till you get pregnant. I mean, till the beta HCG pregnancy results come. So that's about a month. And it depends upon the result then. So if you want to try again, you go for a second cycle, it's like that.
Explain about sperm extraction for IVF procedure.
Actually, it is better explained if I had a video with me. But what we do is, when you're talking about sperm extraction, I think you're talking about the artificial method of PISA. That is when the man has 0 sperm count. So we actually put a fine needle in the testis under anesthesia. There is general or local anesthesia. We can do it under local anesthesia. The man can be awake. And then we put in the needle, and then we aspirate the epididymal tissue, the seminiferous tubules, which contain these sperms. So the seminiferous tubules then have to be passed to my embryologist. Dr. Murugan is my embryologist here, and he will tease the tissue under the microscope, and then we extract the sperms from there. Or sometimes when there is obstructive azoospermia, that is when the canal or the channel is blocked, we can even get sperms and motile sperms from the epididymis by just putting a needle inside.
So I'd like to adopt a baby boy, a young one, like 3 to 8 months. I'm single and not married. Is it possible, and what's the process and the cost? So the cost is the same as I said earlier, 12,500 to the agency, and then the legal fees. The process is the same as I explained earlier. Can a single lady adopt a boy? As I said, generally the law says no. However, the law provides for special circumstances. So a single lady can adopt a boy where it's confirmed that there are special circumstances. Number one, where you're already a parent. So I'll give the example of Doris. Doris came and adopted her first child, a girl, who is now 3 years. Doris can decide to come back for a second adoption. Then she's eligible. Now she can decide that she wants a girl or a boy. Or our sister Cecilia, she's already a parent to 3 children, biological. If she decides to adopt today, I know she's married, but as soon as she was single, if she decided to adopt today, then she would be eligible for either a girl or a boy. So that's the first special circumstance where you're already a parent. Then it's open. You can choose either gender. The second special circumstance is where the child has a special condition and it's determined that you're the only person or you're the most suitable candidate to care for that child. So a child could have, for example, cerebral palsy. And there are maybe there are 10 applicants who have applied to adopt that child. And among the 10, this single lady is found to be the best person to adopt that child. Then they can adopt a boy. The third instance where you can be allowed to adopt a boy as a single parent is where you are an appointed guardian for that child. So for example, if someone adopts a child today and appoints you as a guardian, irrespective of whether the child is a boy or a girl, then you can be allowed to adopt the child. And the last instance is where you're a relative to the child. So if it's your nephew or your niece and you're trying to adopt them, so whether they're a girl or a boy, you may be allowed to adopt. And finally, where the child has a sibling. Okay, in adoptions, you don't separate siblings. So if it's a set of twins, for example, and you've been found and approved to adopt the girl, and the other twin is a boy, they can't be separated. So then in that case, you're allowed to adopt a boy, even as a single lady. Is that last one clear? Yeah, so where there are siblings, we don't separate them. So if there's a brother and a sister in a children's home, and you've been assessed and approved to adopt the sister, we will give you the sister plus the brother. We give you the full package. Is that clear?
The same price.
It says, is IUI possible with person above 42? I think why we decide on individualized treatment is because 42 does not mean we don't have good eggs. So I don't know if your AMH levels are high, you have good eggs. We've had patients who have gotten pregnant at 43 with IUI. We've had natural patients who've gotten pregnant at 44. But you see, they have good eggs, their tubes are open, the sperm is good, probably they just delayed in childbearing, they were doing other things. So it's not everybody, it depends on what your problem is. Okay, last question, then I can give it over, is please talk to us about the egg freezing process, i.e. who can do it, when you can do it, how much it will cost, how long can one freeze. I'm taking that this means oocyte freezing. I think this is from the West. This is the new insurance policy for up and coming women who want to delay their fertility because of various reasons, number one. But egg freezing is also being used for patients who have been diagnosed with cancer and will be taking in chemotherapy, and which is harmful to your ovaries. So egg freezing is really a good thing. It's around the same cost of the IVF because it is the IVF process. All we're going to do is we're going to give you medication for the 10 to 12 days. We're going to extract your oocytes and then we are going to freeze them as oocytes alone. If you're having cancer and you're married, then you freeze them with your husband's, which is embryo freezing. And then the process is that they are stored in very low temperatures in liquid nitrogen. And it is, right now, the oldest child, I think, who was born from any frozen material, embryos is 20, I think 3. And that just came out last year, that an embryo that was frozen 23 years ago is now a baby. So it's safe, depending on where you are. Are you learning? Yes. All right, Dr. Kandwala, you have any questions?
So I've been asked about somebody trying to conceive for 7 years, had undergone laparoscopy, one tube is blocked, and not able to raise the money for IVF. And yeah, so it depends upon the age of this lady. If one tube is blocked and the other is patent, then we can try intrauterine insemination, which is much more economical than IVF, 1/10 the price of the IVF, provided the age is below 40 or around mid-30s. And then we can induce her with medication to grow more, 2 or 3 follicles or eggs, and then do the IUI. The best thing about IUI is, since it is economical, we can repeat it 2 or 3 times. The fertility rate for one cycle of IUI is about 15% pregnancy rate, but it goes up as a cumulative cycles you do. So when you do about 3 to 4 cycles, you achieve as good success rate as IVF. So that was Q1. The second is, does NHIF able to cater for the full fee? Yeah, they are able to cater for 450,000. And in our clinic, we have quite a few NHIF patients who do IVF as civil servants. You have to be a civil servant or NPS. What happens to, why does the embryo not grow during IVF? What causes the embryo to stop growing during IVF before it is transferred? Now that we don't know exactly what happens, because there's a cellular arrest that happens. There can be fertilization. Fertilization does occur, but then somewhere along the line, there is an arrest. So on day 3, when we transfer the embryos, it's supposed to be 6 to 8 cells or more. But sometimes we see on day 3, when we remove the embryos from the incubator, there's just 4 cells. And this is an arrested embryo. We don't know exactly what must be the cause. Some of the causes could be that you do not have a proper culture medium, or your lab is not up to the mark, or you do not have optimal incubator conditions. As I told you, we have now what is called as the time-lapse imaging incubator, where we can actually see the growth of the embryo happening inside the incubator without removing it and seeing it under the microscope. So we know at what stage it can arrest and what could have happened to this particular embryo. The last is, can I take this or should I?
How much is medical
So it's roughly $500,000, including medication, investigations, and everything. That's what we charge for a cash patient.